In this video, we're going to be looking at the research method of case studies. So case studies involve an in-depth analysis, an in-depth study of an individual, a small group of individuals, an institution, like, for example, a psychiatric hospital, or an event. They're often carried out on unusual or atypical individuals or events. So, for example, a person who has a rare disorder or has experienced rare life circumstances. Or it could involve an analysis of an unusual sequence of events. For example, the events that led up to the 2011 London riots, for example. They often involve the collection of qualitative data. So this is data that is non-numerical, i.e. it's collected in words, descriptions. So some examples of investigations that might lead to numerical or qualitative data could be questionnaires, observations of the individual's behaviour, or interviews. And these could be carried out on the individual themselves, or this could be on their friends. We might ask them for information on the individual via interviews, family, etc., schools. So they usually do involve the collection of qualitative data, although not exclusively. Sometimes we might also carry out some experiments on the person as well, and that would lead to collection of quantitative data, data that is numerical. So they tend to take place over a long period of time. That's what we mean by longitudinal. They may involve gathering information from friends and family, from the person's childhood, all the way up to that person as an adult and their friends and family now. And they are an idiographic approach. Now, this is a term that we're going to look at much more in upper sixth. Basically, idiographic means that we're really focusing on an individual in detail, rather than trying to study many people and make generalizations about behaviour. What we're really focusing on here is the individual and understanding that they are unique and their circumstances are unique. So they're very individualistic. So this is your AO1 for case studies. You need to be able to define and explain them. And we're going to be looking at a number of really famous case studies in psychology throughout the course. So now we move on to evaluating case studies. We need to know whether this is a valid, a useful, a helpful research method for us to investigate behaviour. So in terms of the major strengths of case studies, they allow researchers to investigate situations that they wouldn't necessarily be able to study otherwise. So for example, with the case of somebody with brain damage, we wouldn't be able to inflict that brain damage on somebody to see what the effect of that damage was. So that would be unethical. So researchers couldn't actually set that experiment up. So it allows us insights into situations that we wouldn't be able to get insights otherwise. And likewise, sometimes it's really impractical. So again, we wouldn't be able to set up the events that led to the 2011 London riots, for example. That would be both unethical and impractical. And so we're able to take situations that are real, people that are real and have suffered from, for example, real injuries, and we're able to then study them. So this provides us then insights into unusual or atypical forms of behaviour. So sometimes case studies are on, inverted commas, normal, usual, typical people, but quite often they're on unusual individuals and situations. So this allows us some really important insights into their behaviour, and this could be more meaningful than other forms of research, for example, experiments or questionnaires. So all of this helps to contribute to our understanding of typical behaviour. If we can understand what's going on in the brain, for example, of an atypical individual, then that might give us some clues as to what that area of the brain is responsible for in typical individuals. And a good example of this is in the case study of HM, who we're going to be looking at in our study of memory. So HM had his hippocampus removed, and he was fairly normal afterwards, except for some really interesting observations to do with certain tasks that he could perform and other tasks that he couldn't. And the study of HM and his behaviours led us to understanding more about memory and the difference between short-term memory and long-term memory, and also led us to understanding the role of the hippocampus in memory. So by investigating an unusual person like HM, who had sustained damage to his brain through a surgery to stop his seizures, we're then able to understand more about typical functioning in a healthy, non-clinical patient. And then finally, it provides us with really, really rich data. So we've got a lot of information that we can draw upon, and this provides us with unique and new and novel insights. So this could mean that it could lead us to creating new hypotheses, or it could mean that we might need to revisit and revise an entire scientific theory. So for example, if we gather some data that contradicts a theory, then that may lead to the entire revision of that theory itself. So by studying just one individual case study, it may lead to a brand new field of psychology that we didn't know existed. So it's really interesting. However, there are some limitations. Because we're studying unique people, we're often studying really small samples, sometimes just one person, sometimes just a small number of people, and they're often unusual or unique in some way. It means that it might be really difficult to generalize their findings to the general population. For example, if we're studying people that have had surgery, like HM, it might be hard for us to draw conclusions about what was happening with his memory because he had received that surgery because of epilepsy, and he had undergone a brain surgery that normal individuals don't have. So it means that any findings from HM may not be applicable to other people. They may just be unique to HM. And that's often the case when we're dealing with clinical patients, patients that have some sort of disorder or disease or something that makes them clinical. It's also really difficult for us to replicate these studies. If somebody has brain damage from a car accident, we're never going to be able to find somebody who has sustained the exact same damage in their brain to see if the findings are reliable. We're never going to be able to replicate the events of the 2011 London riots. They're often one-off unique events. And so if we can't replicate, we can't verify the findings, we can't check to see if they are reliable, we can't check to see if they are accurate and valid. So it means that this may not be considered a scientific method. But it may lead to further investigations that are scientific. The information that we gather is often retrospective, which means that we're looking back in time. So we might be asking somebody to recall information from their childhood or recall information from when they were a teenager. And that might be 80 years later we're asking them to do this, for example. We know that their memory may not be accurate. So their memory may have faded in that time. They might just not have accurate memories for that period. So we can't be sure that the information that we're gathering is actually accurate because we're gathering the information after the fact. And case studies may be prone to bias. They're quite often highly subjective, and that's because of the qualitative nature of the data. So we're basing our observations on the reports of friends and family. They're going to be subjective. It might be on the patient themselves, which is going to be subjective. And it could be on the observations of the experimenter as well. Observer bias. So because often these studies go on for a long period of time, they are longitudinal. It means that the experimenter gets quite close with the patient. You know, patient HM was studied for a number of years, perhaps even a decade. And so you get quite close to the person that you're studying, and that can sort of cloud your judgment and make your observations a little bit more subjective. And so this could be a problem with case studies.